health liaison for the rural and tribal communities here in Pima County. And this is our school health update, May 7th, 2025. Today's agenda is going to be as follows here. We have our announcements. We are going to have our EPI update. We have 3 programs presented today: PCHD Teen Mobile Clinic Services. We have the Prescription for Health program, and then we also have our PCHD Oral Health program going to show us some great stuff for the summer here. We always end at the end. We're going to finish at the end with our Q&A. Please hold any questions that you do have towards the end, and then let's get started. So next we have is our announcements. Our announcements are going to be subscribing to our monthly newsletter for PCHD. You have here the link that you can click up. You can sign in as well. And then also the next announcement we do have is get access to Healthy Kids AZ free mobile app. So this app is for all Arizona school nurses, health aides, and childcare staff. Again, you can click on that link there and sign up there for your school. Also want to let us know that this is our last school health update. We're going to be taking a break for our summer months, and the next school health update will start. Actually, I do apologize. Should be September 3rd, not August 6th. September 3rd will be the next school health update. All right, heading forward here. So I am actually going to be calling Mr. Jay. Can you please come on here? We do have the on your program now. I'm ready for you.
Thank you, John. I appreciate the quick intro. And so
Yep.
My name is Jay Bankett. I'm the Deputy Division Manager for grant services, as well as overseeing the mobile outreach departments.
I'm sorry.
I want to go ahead, John.
I'm sorry, Jay. Do you mind if I just stop you right now? I do have a different slide that I'm going to pull up here. I have
Sure.
EPI actually coming in on going to be providing us with their update. I do apologize, Jay.
Yeah, no worries. I'll stand by.
I'm gonna stop sharing 1 second, everybody. Thank you. Thank you so much. Please be patient, everybody. I'm gonna have. So I'm going to go forward again with the, let's see, the school health update. Excuse me 1 moment. I'm sorry for that, people. Shit, where is it, dude? Everybody, thank you so much for being patient. I do apologize for that, Jay. So we're going to go again here with the slides, and I do have the correct presentation on there. Thank you. And then I'm going to ask Jake actually to present here. This is going to be the EPI portion.
Hi, good afternoon, everyone. My name is Jake Alexander, and I'm the outbreak epidemiologist at the Pima County Health Department, and I'll be presenting on our respiratory update for today. Next slide, please. So there's actually not a ton to update on right now. We are moving out of respiratory season. And so as you can see from this first figure, which shows our RSV seasonal report, case counts have dropped significantly as we lead into the summer months. We did have a somewhat delayed increase in RSV cases. Normally, we would have expected our peak to be around mid to late December, but instead we saw it in between February and March of 2025. We did have a higher than expected number of case counts for this year, so it's good that we're moving into the summer months and we'll see those start to drop off. Next slide, please. Similarly, here is our influenza seasonal report. Case counts were higher than, I think we lost the slides. Oh, there we go. Case counts were higher than the previous year and than the 5-year average. Again, we're moving out of respiratory season, so we would expect these counts to start to drop off and stay low until we get to fall and winter of this year. Next slide, please. And finally, we have COVID-19. As you can see, our COVID counts have stayed very low in comparison to the previous year and the previous few years average. John, I think we went forward once by accident. There you go. So yeah, as you can see, our counts for the current year are less than the 2023 to 2024 respiratory season and significantly below the 4-season average. Next year, hopefully those counts will stay low as well. And now we can move on to our final slide. And this slide just shows our respiratory diseases plotted on top of each other, so you can just see the counts in comparison to each other. So at the current time, we do have more COVID than flu and RSV, but total case counts for each of them are very, very low, which is great. Does anybody have any questions for me? If not, I will pass it on. Thank you very much.
Thank you so much, Jake, for that. I appreciate your diligence in the EPI report today, and we'll see you in September. All right, so we're going to go on to the next program. I do appreciate your patience with us, with Jay as well. This is the Teen Mobile Clinic Services. We have Jay Bankhead going. Go ahead, please.
Of course. Well, welcome back. If you want to go ahead and kick the next slide. All right. Once again, this is for the mobile services, and we're focusing specifically on the Teen Mobile. You see a picture of one of our mobile rigs there. That's a large Winnebago that does have an exam room in the back. Currently, our program manager space is vacant, but our program coordinator is Michelle Magana, public health aide Geraldine Clark, and then our drivers, Alex and Mario. Next slide, please. And I do want to give credit to Ann Hoffman, my boss, for the slide deck. I am definitely borrowing from her, so kudos to her for that. Next slide. There you go. So there's just a picture inside if you've never actually been inside of the mobile. Essentially, it's been all the chairs, couches have been taken out. They've modified it and added some exam table in the back, as I mentioned. There's some conference room. If the picture on the top, there's a conference room to the right where confidential conversations about STI history, testing, personal behaviors, that happens behind a closed door, which is nice. And then also on the counter to the left, you'll see there's a centrifuge for processing blood and specimens as well. Then a picture on the right. Next slide, please. Okay, a lot of words here. Basically what we do is with the Teen Mobile, majority of the services are going to be comprehensive reproductive health and education, and then information. We do add abstinence is an option, and we do push that as well. It's really about with the education to promote healthy sexual behavior, reduce the incidence of unplanned pregnancies, and then also sexually transmitted diseases. Provide free, non-judgmental. This is really one of the big things we want to push because we want the students to feel that they can trust us, that we're not going to be sharing any information based on what we hear from them, and also let them know that it is free. A lot of the students don't have the means to pay, so we don't want that to be a barrier as well. We do target the populations between 14 and 21. The services that we provide: pregnancy testing, counseling and referral, if they do end up being pregnant. Then we provide HIV and STD screening, both birth control methods, condoms, and partner services as well. Although parental involvement is encouraged with the students, services do not require parental permission. So if someone comes to us, they want to keep it private, not share with the parents, we absolutely can provide that to the students. And one of the things I want to point out as well is that we're really trying to get away from just focusing on STI testing and birth control and reproductive health. There are other services that we can offer, and we want to make sure that we're branching out and being more than just the pigeonholed services that we've historically done. So if folks from the school have any ideas of things they'd like to see us do more, whether it's mental health, whether it's dealing with drug addiction or any kind of issues dealing with adolescents, we'd love to hear from you, and we will do our best to bring those services to the school visits to make sure that we're offering more services as well. Next slide. All right, when we do approach the schools, we work very closely with the nurses. And usually what the process is now is once you've got an agreement to come to the schools, we typically have a 4-hour appointment schedule. And as students express interest, the nurse will then place them on the appointment schedule, and they will get passes to come out to the mobile, have their visit, which is usually about 30 minutes, and then they'll return to the nurse to get a pass back to class. Students, typically our biggest marketing is student word of mouth. So we do have flyers that we do post at the school just with a basic understanding of the services, and then the requirements for them to come and sign up with the nurse. They do typically come out, ask us a lot of questions about birth control and other services. We do get a lot of folks that do want to do testing, and we want to make sure, once again, that it's a safe, non-judgmental environment. Next slide, please. All right, here's just a listing of some of the testing and the services that we do as well. You can kind of see that on the right side, there are quite a few options for birth control methods. We do hand out condoms for free. We can start them on birth control pills, and we do have a nurse practitioner that is on board with us. So we do have a clinician that can diagnose and then also provide treatment as well on the van as well. So Depo-Provera shots, they can place Nexplanon, IUDs, and then also the Plan B is an option as well. All right, next slide, please. All right, so right now, our two largest school districts that we do serve is Sunnyside as well as Tucson, and we do serve charter schools as well. And so that's right now is our majority. If we currently are not serving your school, or you want to have a conversation about what that entails, please reach out to the outreach email. I believe it's at the end of the slides. But if you currently are not involved or you have questions about the current services, please reach out. We'd love to have a conversation and see how we can adapt to whatever your needs are and make sure that we get you involved in our program. Next slide. This is just one of our flyers showing that we do offer some resources informationally in Spanish as well. We do typically hit the schools, high schools. We also reach out to libraries as well. You can see that there's a program that we have second Friday of the month, and we will rotate libraries throughout the county. There is a QR code that's on this flyer so that folks can redirect back to our main page. Next slide. All right, this is just a picture of one of our flyers that we do place up in the schools. and you can see that it's got the name of the school, the address, and then it talks about the specific day. What we want to add going forward is a listing of all dates. So if this one would be Totonacalia High School, we're going to list every third, and then we're going to put the specific dates like May 3rd, August 7th, just so folks know where we're going and where we're going to be there as well. So this is a universal flyer that we give to all schools, and then we customize it based on the school and the dates will be there. Next slide. All right. Really, before the questions, just want to reiterate the fact that if you are with the school or you are connected to a program and you would like to see more services added to our visits, or there's something that you want us to make sure we have education on or resources to, please reach out. We are looking to expand our services that we offer. We do have a clinician on board, so we are looking forward to really expanding that and meeting your needs as a school district. Any questions? All right. Not hearing or seeing any, I'll pass it on to the next presenter. Thank you.
Thank you so much, Jay, for that presentation. I do appreciate the hard work that the mobile unit does do around the county. I actually go with them sometimes to Ajo with them, so they do reach a very wide audience, and they do a great job. So we're going to go on to our next program that we have here. It's going to be for the Prescription for Health program. We do have a speaker today, Brian Dennis, who will present for this program. Brian, you on?
I am. Thank you, John.
Sure.
And so, yeah, my name's Brian, and I am with the Racial and Ethnic Approaches Community Health Team, and I'm just here to share about a collaboration that we currently have with the Sahuarita and Marana food banks for our Prescription for Health program. Before I move on, I do just want to highlight that our community health workers have been an integral part of this with recruitment and also with communicating with participants. And Grace and Clarissa created this presentation and unfortunately weren't able to be here today. So with that, John, if you want to scroll forward. So what is Prescription for Health? So it's largely a nutrition program with also some other components that last 12 weeks. It's a 12-week series of classes. And some of the things it does incorporates more nutrient-dense food into one's diet. So in addition to just the nutrition education and food demos, it has optional classes related to chronic diseases such as diabetes, also has physical education week. And then within the class, there's a food demonstration, and then there's fresh food provided with recipes that the participants then can take home and then prepare what they learned about it with the food demo. John, if you don't mind. So who can attend? It's open to anyone and everyone. So the class is free and open to anyone that wants to make healthy changes in their life. Certainly one group that this could be potentially beneficial for would be someone with a chronic illness such as heart disease or diabetes, or on the verge of developing a chronic disease. And then hopefully this class can lead to changes in behavior in terms of eating habits and physical activity. Just as it says, anyone and everyone can attend, but it does occur through the food banks. And someone might think, do you have to be a food bank client to utilize this? You do not. It's open to anyone. Classes are currently taught in English, but Spanish translation can be provided. The plan is the person that is teaching it, they're planning to hire someone else who will learn from that person and then ultimately be able to provide the class in Spanish independently. But at the moment, it would be Spanish translation. John? So where the classes are held. So as I said, it's a 12-week program. And the food bank has two physical locations, Sahuarita Food Bank and the Marana Food Bank. And so it occurs there. They do also have a mobile unit. It's a big trailer where they can go out to smaller to locations, and it functions for fewer people, for 8 to 10 people. And like I said, they go out to multiple locations. They just finished up at Summit View, plans to go to Arivaca, and actually in June, they're going to be starting a course at the Southwest Family Resource Center, which is through the Tucson Unified School District. When they do the mobile class, they do a 4-week version, and it's basically going to be nutrition and the food demos. There is the potential for expansion. They are interested in possibly going to other locations with that mobile unit, so they have some capacity for that. It really, if you're at a site and you think you have at least 8 people that are interested, certainly reach out to us and we can see about possibly having them come out to your location. But at the moment, the mobile unit is in June, Southwest Family Resource Center, and probably another time at Summit View. Classes are held throughout the year on a rolling basis. So in other words, if we have more interest than we can fill in those classes, we can certainly have a wait list. And then as the class ends, another one will start. John? So where are the classes held? So they are, or excuse me, when are the classes held? Classes are held once a week for 12 weeks. Each class is about an hour and a half in length. Currently, the Sahuarita Food Bank class, the next class is planned to start on May 13th and from 3 to 4:30 in the afternoon. Marana is actually to be determined, and it boils down to when we recruit people, we're trying to get a large enough number of people that are interested before we actually set up a class. So at the moment, we're still trying to recruit and haven't set an official date for the class in Marana. John? So just to give an idea of some of the topics that will be discussed, so benefits of living a healthy lifestyle, sources and benefits of the 3 macronutrients, proteins, carbohydrates, fats, tips for getting more fruits and veggies into your diet, eating a balanced meal. It came up in a presentation that someone was asking where the presentation came from. And so Wheezy is the person at the Sahuarita Food Bank, and she created the presentation. And she leans heavily on the myplate.gov website and then also factual information from CDC websites. Also includes reading of nutrition labels, special diets for different illnesses and goals, cooking healthy on a budget, and then some light physical activity. One week in particular is devoted to a physical activity class. John? Just to give an idea of what that framework looks like. So month 1, the CHW stands for Community Health Workers. So as I said, the community health workers are kind of an integral part of this. They attend the classes and they'll talk about how they can assist. But then there's also a food demo, nutrition education. You'll see diabetes, physical activity, and then there's a resource fair at the end. And then the community health workers are checking in periodically to see if there's any assistance or questions with the program that they can help with. John? So I did want to have this slide in here because the community health workers do play a big role. So they've been helping a lot with recruiting participants, but also they're there during the classes. They're there to build relationships with participants and there to have conversations and provide resources. Doesn't just have to be related to the class. They can certainly talk about other things that the health department does or other resources available in the community. We do have a pre and post survey. The community health workers do assist with that. And just as an example, the plan is to have, hopefully they'll be able to help with things like SNAP and WIC enrollment. Chuck? So why are we here? So we're hoping that you can spread the word there. John, if it's all right, I can share the updated flyer here in the chat, but if you can share the flyer with any community members you think might have a need or an interest in nutrition education, that flyer, it's down at the bottom in the white. There's a link a website people can go to register for classes. If they do that, a community health worker will reach out to them and check with their interest, answer any questions, and get them signed up. And so that's about it. And And this was just a quote that I think Clarissa and Grace created, but it says healthy living often gets put on the back burner. But our hope is that this class can be a step towards making health and wellness a priority in our communities. Thank you very much for the time. And John, is it okay if I share the flyer in the chat?
Brian, please share that flyer in the chat. We really appreciate your presentation today, Brian. And again, on that contact information of the two community health workers, it's Grace Corbett's email and information, and also Clarissa Savel's information and her phone number as well. Thank you, Brian.
Thank you, sir.
All right, so we are going to go next to our oral health program. Margaret Perry will be on the presentation side here. Margaret, are you there?
Yes. Can you hear me okay?
Yes, we can.
All right.
Take it away.
Sure. Thank you. So yet another prevention program we have here at the health department. It's a program that's been in existence or implemented by Pima County since 2004 in the local school districts. So it's administered by ADHS, Arizona Department of Health Services, but implemented by county health departments throughout the state. It's a cavity-free AZ is the sealant program. It's an evidence-based program, which means there's a lot of research to support that if we can get into schools and address the children at high risk for dental decay or serve those children and put sealants on their permanent molars as soon after they come into the mouth as possible, that we have a great opportunity to prevent 80% of cavities. It's a huge number. Most of the cavities do occur, 9 out of 10 cavities occur in our adult molars in the back. And kids in 2nd grade and 6th grade are getting those adult molars at those ages. And that's why we target specifically those grades. So we reach out to the schools. It's actually the schools that qualify. So the schools have to be 50% greater free and reduced lunch. And once the school qualifies, they're invited to apply. And then we go out and start the process. Once the school has applied, we reach out. Andrea, our program coordinator, and Sarah, our new community health worker working with us, will reach out and schedule an oral health education for the different grades, the 2nd and 6th grade. We have a new redesigned program that helps to address some of the learning standards that are required in schools. So while we talk about dental sealants and taking care of teeth, it can help address some of those specific health standards that schools are required to have for the children. Once they've received the education, they take the consent forms home to their parents and bring them back. And we reach out, find out how many consents have been returned, and then schedule a date for a clinic out at the schools. So we're able to bring the service right to the school. That means the children are out of class for maybe 15, 20 minutes, and yet get this fabulous preventive service for their teeth. In addition to sealants, and sealants are like a plastic coating we paint on the biting surfaces of the teeth. If you've ever looked at it in a child's mouth or even your own, after you've eaten, these are my, I can't say favorites, but Cheetos, Goldfish, Oreos, you can see where all that food gets stuck in those cracks and crevices on the teeth. The germs are there too. So the kids end up feeding those germs, and that's why we get one of the reasons we get cavities in those back teeth. The food sticks around. And so we want to seal those grooves off and seal the germs out of the teeth. We also have a new fluoride that we have a consent form. So the parent has to consent to all of these services, obviously. But the silver diamine fluoride that actually helps stop cavities from growing. So some children might receive sealants because they don't have cavities in those molars. And then the children that might have a cavity in those molars, we can put the silver diamine fluoride on there to stop the cavity from growing so that they can get to their dentist and have it repaired. So it's been a wonderful addition to the program. We have a small portion of the program that also addresses kindergartners. We know, again, how important prevention is right from the start. So the kinder program, we apply fluoride, paint fluoride on their teeth to help strengthen the baby teeth that they have. And then some of them even are getting their adult teeth at that age. And when the teeth come in, they're not really as strong as they can be, but the fluoride helps to strengthen the teeth to resist cavities. So a lot of great services, very simple. We have no shots, no drills. This is always a very positive experience for the kids, and really works well. Very efficient program. So one of the reasons we're here to talk today is because at this time of year, we're actually reaching out to the schools to invite them to apply to participate for the next school year. I know many of you are still dealing with the end of this school year, but this is our next step. So you can see here all the schools that are eligible in our different school districts. TUSD is certainly one of our largest districts and one of the largest districts we serve. Sunnyside is right behind them. The other ones are a little bit smaller, but just as important. I think the best part about this program too is that there's no cost to the schools or the families. So as long as the child is enrolled at the school that's eligible and in 2nd or 6th grade, bring back a parent consent, they receive the free services. Next slide, please. So how do we participate? Well, no, let me start with, again, what we've done this school year, because we have had one of the best semesters we have had since COVID. COVID really hit oral health hard, as I know, are all aware. So this year we visited over 90 schools. Over 4,000 students received preventive education on oral health, and over 1,700 students received some preventive dental service. That could have been fluoride, could have been a sealant, could have been the silver diamine fluoride, and they all received a toothbrush and toothpaste and things to help them take care of their teeth. So just again, by bringing back their consent, they were able to receive some additional little goodies, which, we all love. So what we're asking, and we have sent out information to the health managers in all the school districts and to the principals and health staff. Some snail mail went out to those people to have them apply for the program for the next year. It's really very simple. They can either go to cavityfreeaz.org or use the QR code. It takes them right to a page where it says schools apply here. It's probably about 2 minutes to apply. It's, the school's address, contact person, some of the holidays that we need to avoid, spring break and things, just to give us some information how we can go about scheduling. And then once that's completed, we reach out. Like I said, Andrea and Sarah will reach out to schedule a time for us to come and do the education for the kids. Okay, next slide, please. And just to introduce the rest of our teams, Andrea, as I said, is our program coordinator. She's been here with the county over 6 years. She's a registered dental hygienist, and she's one of the main providers. Matt is our public health specialist. He's our driver extraordinaire, we call him. He will help when we get to the schools to round up the children and get them back to the RV. We come out in a mobile RV, different than the mobile medical. Ours obviously is a mobile dental. You may have heard me say this before. It was bought with bioterrorism dollars back in 2005. So ours is a little bit of an antique, but it is a workhorse, and it's a very wonderful unit. We're very, very fortunate to have it. It allows us to visit all of those schools and get those services out into the community. And then our newest addition is Sarah, who's a community health worker, and she has been here for just a week now, but very excited to have her join us. She's excited to learn things. She's got children of her own and is excited to be able to take some of these things home and teach them as well. But she will be doing the educations in the schools along with Andrea and helping out actually in the clinic too. She will be our chairside dental assistant. So the sealants are applied with a hygienist and an assistant working together to provide the services. And I think that's all I have. So if you have any questions, just let me know. But we look forward to working with you all again, another successful semester coming up. Thank you.
Thank you, Margaret. That's a wonderful presentation from the oral health program. So everybody, I wanted to thank everybody on the call for joining us today. Again, this was our last school health update for the 2024-2025 school year. I do have information. If you wanted to contact us directly, you could always contact us here at pima.gov/healthy schools or school support at pima.gov. That's our email. And then you can give us a call on that 520-2724-7018. If anybody has any questions, you can put them in the chat. But again, I want to thank everybody who presented today. You all do wonderful work here for the county, and we really appreciate your due diligence to coming on and presenting your programs to everybody in the schools. With that, I'm going to stop sharing my screen. And look at a chat here. All right. I'll wait online here if anybody has any questions. If not, I really appreciate everybody's day and time, and you have a lovely Wednesday afternoon. That's what I said. I'm gonna stop recording.